Sitting at home over the weekend, you start thinking about all the things you have to do this upcoming week. Meetings, reports, phone calls, emails, so many things that you're not even sure that you can get it all done. It's been pretty stressful at work lately, and it's certainly not helpful that the market has been so volatile. All this talk of recession, even an economic depression, has been making things even more chaotic and stressful, and you've been worried a lot about your savings. It feels hot and stuffy inside, and you think you might need to get a little fresh air. All of a sudden, you notice your heartbeat. It seems to be beating particularly strongly, and maybe even a little fast. That seems strange. You're not doing anything that could account for your heart beating faster. Then you notice that you're feeling a little hot. Your face feels flushed. But your hands, your feet feel cold. This doesn't seem right at all. Something must be wrong. Your breath starts coming more quickly, and all of a sudden it seems like you can't get enough air. Things are spinning, out of control. You're feeling dizzy. Your heart is beating faster, and you can't breathe. This must be what it feels like to have a heart attack. You start worrying that you're going crazy, or maybe even that you're going to die. This is the worst you've ever felt in your life. You need help right now. Frantically, you call your doctor, your partner, your family, maybe even 911, anyone who can help. They all advise you to go to the emergency room, and there, you ultimately learn that you're physically fine. There's nothing wrong with you. Your lungs, your heart, your body, everything checks out okay. What happened? You just experienced your first panic attack.
What is a panic attack?
A panic attack is a sudden rush of intense anxiety or fear for no apparent reason. During a panic attack, people experience both physical and mental symptoms. Physical symptoms can include heart racing or pounding, hyperventilating, sweating, trembling, chest pain, tingling in hands and feet, hot flashes or chills, dizziness, a sense that things around you are unreal, or feelings like you're choking or being smothered. Mentally, a panic attack can be accompanied by thoughts that you're going crazy, losing control, or even going to die. Given these symptoms, it's common for many people to think that they're having a heart attack and seek emergency medical attention. Typically, the actual panic attack only lasts between 5 and 10 minutes, but it is a very miserable period of time. Also, you can feel somewhat drained and out of it for up to several hours afterwards.
What's the difference between a panic attack and panic disorder?
A panic attack is a specific, single event. In contrast, panic disorder is characterized by having 2 or more panic attacks, as well as persistent worry about them or concern over the possible consequences, such as losing control, or a significant change in your behavior related to them, such as avoiding places where you feel out of control or avoiding places where you've had panic attacks in the past. Sometimes panic disorder is accompanied by agoraphobia, in which you actively fear situations in which you might not be able to escape or get help easily, such as traveling on a plane or subway. You might avoid these places entirely, or need the presence of a support person, or suffer through them with much anxiety.
Do a lot of people suffer from panic?
Yes. A recent epidemiological study suggests that over 20% of Americans will suffer a panic attack at some point in his or her life. Panic disorder is less common. It's estimated that close to 5% of the people in the U.S., or about 14.5 million people, will develop panic disorder at some point in their lives. This is equivalent to the population of New York City, Los Angeles, and Chicago combined. Age-wise, panic disorder typically develops sometime between late teens and mid-30s. There is also a significant familial or genetic contribution. If one of your parents has panic disorder, for example, then you're 8 times more likely to develop the condition than someone else. Agoraphobia accompanies panic disorder in about 1/3 to 1/2 of cases.
Is there overlap between panic disorder and other kinds of problems?
Yes, the development of panic disorder has been associated with various medical conditions, depression, other anxiety disorders, medication side effects, and the loss of a significant relationship. Because the symptoms of panic can be similar to other kinds of conditions, it is important to have a full medical evaluation to rule out other potential causes, such as hyperthyroidism, atrial fibrillation, etc.
What causes a panic attack?
Panic attacks start innocently enough with a specific situation or physical sensation. The situation might be something traumatic, like being stuck in an elevator for hours, or something more normative, like being in a place that is hot, stuffy, and bright, such as a crowded shopping mall. Alternatively, we might notice a particular feeling in our body, like a skipped heartbeat or muscle tension. This specific situation or physical sensation triggers an automatic thought that there is something wrong or dangerous happening. This process can be very quick. You might notice that there is no way to exit a plane or subway car. Alternatively, you might become aware of your heartbeat and think that it seems to be beating a little faster or harder than usual. This seemingly innocent thought comes fast, and often you're not even aware of having it. However, it gets the ball rolling by prompting you to have an emotional reaction. In this case, the emotion is fear. Fear is a very intense emotion, and it brings about specific changes in the body. When we feel afraid or under stress, our sympathetic nervous system responds with what has become known as the fight or flight response. Our body is preparing us to either fight something or run away. The corresponding changes in our blood flow and respiration allow us to take immediate action in order to ensure our survival. It is a normal and necessary response that has helped us confront or escape life-threatening danger. If we don't have it, we would get run over by a car, die in a burning house, or get eaten by a tiger in the jungle. It is important to know that the fight or flight response has an impact on many different areas of your body, even perception and rational thinking. It is a very sensitive alarm system designed to hijack all of your physical functions. When confronted by a threat, it makes sure that you stay alive. During a panic attack, however, this normal physiological reaction becomes the focus of your attention. You start to notice the physical changes in your body and misinterpret their significance. You incorrectly believe that your body is experiencing something catastrophic, which only serves to intensify the fight or flight response and ultimately bring about a panic attack. Put another way, your body does not react to an actual threat in the environment. Rather, it responds to your thoughts that something dangerous is happening.